Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined as always by Viv Hudson. And Viv, we have a topic that we've already spoken about before, but is on the tip of everyone's tongue today. Do you want to let everyone know what that is?
Would it be PCR testing?
PCR testing. And I got to tell you, the more I learn about PCR testing, the more enthusiastic I am about the applications for PCR testing. And I was having breakfast last week with the lab owners at one of our lab partners, Zion, and Victor Castillo, who is joining us right here, was giving me some good pearls. And I thought, Victor, this would be great for all the people who are out there pushing PCR testing to learn what's been working for you guys. So Victor, I want to thank you for getting on today.
Oh, thank you for having me. It's great to take this opportunity and learn from each other.
So PCR testing, you guys have been involved with PCR testing for a little bit now, and you're having some good success. Now you're doing the respiratory and GI, correct?
That is correct. We have an upper respiratory panel that tests for 20 different targets, and a gastrointestinal panel that targets about 22, all the way from bacteria, parasites, and viruses on the GI side, and viruses and bacteria on the upper respiratory panel.
So what do you see as the main advantage to using this technology, to using these panels? What is motivating a doctor to order this test?
The main reason for using this type of test is that you use one sample and you're testing for 22 different pathogens. And the turnaround time, which is anywhere between 24 to 36 hours, and having results. But usually it's pretty much overnight when doctors can have results. Here's the thing. Many pathogens, including bacteria, parasites, and viruses, can cause, for example, infectious diarrhea. But previously, many of these pathogens responsible for these diarrheas and abdominal pains could only be isolated through some of the traditional techniques such as stool cultures or ova and parasite exams that are all often time-consuming and lack sensitivity. Because if you think about the procedure on how you do cultures, you're growing the bacteria, you're growing the pathogen, you're trying to detect it by growing it. So that's how the traditional technique or traditional test methods work. But also, if you want to target 22 different targets, you would have to do, for example, on the GI side, you would have to do at least 19 different tests in order to cover all those 22 different pathogens. But what we're doing here with this GI molecular PCR panel is just one stool sample, and we target all of those pathogens. Now, to improve that detection, also for upper respiratory and gastrointestinal pathogens, we've introduced multiplex PCR test panels. And that's been very welcomed all the way from pediatricians to family doctors and to geriatrics. And when I say geriatrics, also because many of these elderly people are in nursing homes at times, and they're in environments where a lot of contagious and infections are going on. For example, norovirus, which is also known as the cruise ship virus, but you can also get infected, contagious inside an environment such as a nursing home. Many of the outbreaks that happen and that put nursing homes on TV even because there's these outbreaks going on, 20, 50, patients, even 80, including maybe even employees getting infected with norovirus. That's just one, but there's others. Sapovirus is also another virus that is very similar to norovirus. They make these nursing homes look bad on TV because there's an outbreak. It's hard to control them, but that's why I say even in the elderly. But pediatricians, they're seeing kids every day, all year round. All year round, they're seeing kids getting, coming home with headaches, with abdominal pains, respiratory issues. This is all year around because in those environments, all the way from daycares to schools, kids get sick. So this is a test that is not limited by certain regulations that you may have, for example, in pharmacogenetics, that you only do pretty much one time, once in a lifetime, if you do a comprehensive one, or toxicology testing, where you're limited to doing it with a certain frequency and by regulations. But this is a test that you don't have all that red tape, and children, adults, and elderly have illnesses all year round. So that's why it's very welcome. Turnaround time, you're detecting much more pathogens, and now the doctor is able to prescribe based on evidence instead of guesswork. You take the guesswork out of it, and now you are prescribing based on a particular pathogen that has been detected.
Wow.
So as far as speaking to doctors about this, so you've had some success with switching over your doctors already. Like, what has been their what kind of approach are the reps going in to sell this? So what are they actually saying to the doctors to get them to switch over?
Let me tell you a scenario, and these are real scenarios. Okay, because that's all I can share, because this is what actually happens out in the field. For example, we had a patient that was detected with cryptosporidium, which is a parasite that is, sometimes can give you diarrhea, but also gives you persistent cough. So many times you don't know if it's really a GI issue or if it's an upper respiratory. So this parasite gives you both symptoms. So now the doctor is giving lots of medications to this child, for example, and the mom and dad are like, man, my kid is not improving. It's been 4 or 5 days and he's not getting better. He probably was, given certain medication because the doctor thought it was a GI issue, but it ended up being an upper respiratory issue, or vice versa, the other way around. But certain parasites, viruses, give you both symptoms. You want to take the guesswork out of the question. And for example, this was a child that was detected with cryptosporidium, but as of January 2015, this medication is there's only one approved medication or approved drug for the treatment of this parasite. And when we called the doctor to let him know, hey, this is what the kid has, she was so thankful because she was, medicating the child with something else. So you can see right there a scenario, an example, a real life example of how this can be very, very, very good. Yes, go ahead.
No, I will finish your point.
Basically, I was going to just share another pediatric case. It was a 1-year-old that once we ran the gastrointestinal panel, this child was detected with E. coli, astrovirus, and rotavirus. I mean, 3 things. And immediately, as soon as we detect something serious, we call the clinics. I mean, we don't wait. I mean, the results will be eventually on the web portal. But when there's a panic value, we always call the doctors and let them know what's going on. But this was a 1-year-old with E. coli, with astrovirus, and rotavirus. So this kid could have died. Could have died if he was not treated, appropriately and prescribed based on what was detected.
I think there's no better story than something like that, where you have like a real scenario where there's been a major impact made because of that kind of testing. And I think when reps can take around personal stories like that, it makes it so much easier for them to communicate that to the people that they're talking to. Definitely.
That's the way I do it. Doctors will understand better when you paint them scenarios, when you tell them stories. Storytelling is something that I love, because you can get into technicalities and get into specifics, and you can talk about sensitivity and specificity about the test. You can get into science, so on and so forth. But at the end, it's about how practical this is going to be in their clinic. What benefit it's going to bring to their patients, and the elevating the quality of service, of their clinic to a higher standard.
Yeah, and stories are more relatable and they're easier to remember, for sure. And I know for myself, I've been talking to some people. In fact, I did a call this morning with a clinic, and what I've been also kind of pushing the angle of that this is also a public health issue. Because if you have that patient, and like you said, Victor, a lot of times you'll have symptoms that will be identical, but for two totally different disease states. And if you're treating the patient with the wrong antibiotic, number one, we don't need to go into it, but we've all heard about the dangers of overprescription of antibiotics leading to these antibiotic resistant strains of bacteria. But number two, also that patient is not getting well. You're delaying their treatment, which means they're potentially spreading that pathogen to other people, maybe some people who are more compromised, who it's not a matter of missing a couple days of work, but they may be put in a pine box. So it really is a public health issue at the end of the day as well.
That is correct. And if we move this conversation now in the nursing home environment, that's where you would see a lot of that, what you just mentioned. But for the nursing homes, this would provide an important new approach for the detection of multiple respiratory viruses and bacteria in a single test. It would be even a preventive and a screening tool, allowing the early detection of viruses to prevent those outbreaks. It also becomes an infections control tool in the nursing home for the nursing home infections prevention and control program. It would also help the facility reduce hospitalizations. And let me just stop in this one for just a second. For example, in pediatrics, you have that child visiting the doctor, and the doctor needs to make a decision. Do I send him to the hospital or not? So you do a molecular PCR, test on him, whether it be the GI or the upper respiratory, and then you make the decision. The thing is that molecular PCR testing is mostly available in a hospital environment, but when doctors send patients to the hospital, it doesn't look good on them. They're in the curative mode. They're supposed to prevent, they're supposed to cure, and when they send patients to the hospital, it doesn't look good on them. So you want to reduce hospitalizations. This technology is available now at Zion Lab, and we have it at hand, and it's going to help them reduce those hospitalizations. Keep the patients at homes or keep patients at nursing homes if that's the case. But at the same time, we're still talking about nursing homes. It's going to end up being a savings in medications because if you go into a nursing home, it looks like a pharmacy. I mean, they have rooms full of medication, and that's money that costs a lot of money. So you want to reduce cost in medications. You want to save some money there. Start using this tool. You want to reduce lost productivity. You mentioned, Mike, that even some employees, some nurses, administration, staff, the facilities could also get, infected. So you want to reduce lost productivity. You want to have this mindset of being proactive versus being reactive at the end of the day. Think of this other scenario. Let's say you want to screen all your new admissions in a nursing home because, families, when they want to place their mom, their dad in a nursing home, they're looking for a clean facility. And many times what they do, they shop around. they visit different facilities. But imagine if you would have molecular PCR testing as a screening tool for new admissions. You can pretty much give families a peace of mind that their loved one is in a clean facility. So those are just some of the benefits of using
Victor,
and implementing this tool.
You're blowing my mind here. This is Vivian. Didn't I tell you he had some pearls?
He does.
This is just
He
pearl
does.
after pearl. I'm serious. I'm going to go back as soon as I get done with this. I'm going to go back and listen to it. Boy, this is really good information, Victor. You really sell this. You really paint the picture that they'd be foolish not to implement this technology. So, Victor, I want to thank you again for getting on today.
No, thank you so much. Appreciate it.
Thanks. Thank you.